Hey, what's up, Sandy? How's it going?
Hi, Michael. It's going great. It's almost summertime and 100-degree weather here in the South. Other than that, it's great.
Wonderful. We have a special guest with us, Dr. Abby Neville. How's it going, Abby?
How's it going? Doing great. Doing very good. Happy to be here.
Nice.
Excited to
Wonderful.
have you. We are just spreading the word about Plan Forward membership plan. And I know you are a member. You're offering this to your patients, and I'm excited to share. I get so many questions from doctors all the time. It's like many times they're afraid to implement something like this, or they don't have all the information. So that's why it's great for us to have an opportunity to talk to someone like yourself who has implemented it successfully, and you can share all of those successful actions. So that's what we're going to do here today.
Happy to do it. It's a lot harder to do it on your own and not know what you're doing. So this is a very easy system that makes it so that it's already done for you. You just have to implement it. But it's unique to your own practice. You're getting all of your own ideas and what you want to do with your practice just within an organized system is basically what it is.
And that's great. So how long have you been on Plan Forward?
So we've had Plan Forward for about a year now, and we already had our own in-house savings program. So we really just convert all of our in-house savings to Plan Forward. And then anybody new that comes into the practice, they go directly into Plan Forward.
That's easy to do. If somebody listening already has something and they're one of these practices, like I talked about before we started today, who are literally carrying around folders with names of patients and manually doing everything, you were doing that, right?
Essentially, yeah. I mean, it was all digital, but yet correct. We were having them fill out a paper application and then input it into our system. And after it got into the system, it was fine, but we did have them manually filling something out for us.
So much easier when the patient can just go over and sign up. It's very nice. So here's my question. The first one, it's very real world because I talk to dentists all the time and different membership plans come up, or people talk about they want to get off of PPOs, or they don't want to go down that road and they want to have something to offer their patients, but they're so afraid to do a membership plan. What do we tell that doctor?
I, as a solo practitioner, I want to be able to offer a discount to my patients who don't have insurance. I didn't want to do it haphazardly. I wanted to do it in a fair way and a way that we could know how many people we're giving a discount to, essentially, because it is a discount plan is really what it is. And so intuitively, I knew that I wanted to set something up that would accomplish that goal, especially when people retire or they're between jobs or they're consulting for a job where they're not given benefits. This option works really well for them. I did my homework and I hope that maybe everybody else does. But when you figure out what a premium is for a insurance company, and then you figure out how much they're paying for that, essentially they're paying for the premium that I would give them for their membership plan fee. And so the insurance isn't really giving them anything. And a lot of times they're paying what they're giving them in their maximum. So I really have never had any problem with anybody ever wanting to do this. Honestly, it's just providing the idea. And they're like, that sounds great. And the way I always say, because it's true, there's no catch here. You literally, it's a savings program. You're saving this amount percent. And the only thing I'm asking you to do, have your regular cleanings. That's it, which you're going to do anyway. And that's all it is. It's really that simple.
So do you also accept PPOs?
I don't anymore. I used to. And so I did have some people who found out that their premiums were about equal to the membership plan. They were not getting good coverage with me, and they switched to the in-house savings versus their dental insurance.
Oh, that's great.
That was when I made the switch and stopped with the PPOs.
Because also hear dentists, they're saying, well, I never want to take PPO. So maybe this is an option, because I have so many people that are asking about insurance and the practice is fee for service. And then they worry about discounting for those patients that they would put on the plan versus the fee for service practices patients. So they're worrying about having different.
Yeah, meaning that they would rather get their fee than offer a discount. But the thing about it is that people have insurance benefits that they're going to use, even as an out-of-network provider. Even if you're a fee-for-service practice, you're still going to be submitting to the insurance. and people are going to be utilizing their benefits. You're still getting your fee, but you're paying your staff to do all of this work. So you're still discounting, your fees in a sense. You got to do all this other work. With the Plan Forward, you don't have to do any of that. The fees are in the schedule already. You don't have to make discounts. It takes 2 minutes to enter their information and you're done.
Yeah, it's so much work off the front desk too. Let me ask you a question. How much are you discounting your fees?
Okay, so it's about a 15% discount.
Okay.
With the in-house membership general plan with the cleaning. And this is kind of the cool part about Plan Forward is you do it however you want to. The way I choose to do it is that I include 2 exams a year, an emergency exam, any x-rays that we need to take, and some fluoride treatments, depending on, which is a huge savings. And that's about a 20% savings. So the actual premium cost is about 20%. And then everything else, any other dental treatment that they do, it's 15%. You could go less. I just kept it the same as what I did for my in-house because I wanted to transition people cleanly and the cost was going to be going up for them. And I wanted to make sure that it was seamless and it didn't feel like a big jump, essentially.
I like it. I like it a lot. So how did this work? Because it's my understanding you have an associate.
I do.
So how does that work with associates?
What's funny is that one of the reasons I switched to Plan Forward was because I was having a difficult time separating provider production. And in particular for her, because we were having to every week go line item by line item or patient by patient to determine what her collections were. And then within the plan also, I was giving her a certain number for an exam. I was giving her a certain number for an x-ray. And it was cumbersome. It was very cumbersome. So with Plan Forward, they're able to extrapolate her as a provider. And we have a separate report essentially that will pull all of her production with Plan Forward, which is so much better. You can't do that within the dental software system, but that's okay because Plan Forward actually created that report for me when I signed up. So
good.
I had that suggestion and they made it happen actually. So that was really awesome. But you could extrapolate that with hygiene. You could extrapolate that with anything that you wanted to, essentially.
So what do you think if you were to tell the listeners? Because I know there'll be people that are just on the fence. Okay, it's maybe I should try this. What would you tell them would be like the main problems that you saw or that you solved when implementing something like this? What could they expect?
So the setup is key. And you need to know what you want from this as a business owner and a dentist. How much percentage of a discount are you willing to give? And what type of a premium? How many plans do you want? And for me, I thought at first I wanted 7 plans for all different types of things. And then I realized that was not going to work. It was too overwhelming for the patient. You don't want them to ever feel like you're selling something to them. And that would probably be one of my biggest issues is that you feel like you're selling. You're an insurance broker, and that's not something that you want to do. But instead, we call it a preventative plan. We're just trying to make it so that we can help our uninsured patients save some money. Just that simple. But the selling part is the part that I feel most dentists are probably afraid of. And I was too.
Very well said. It just makes sense to me. It just does. But how can the technology solutions like Plan Forward, which I know they have great software, help practices scale their membership plans and streamline their workflows?
Sure. The people who work for Plan Forward are incredibly knowledgeable about the dental world. So they're not just going to teach you about creating a plan. They're going to teach you how to make this the most efficient way to work in your practice. One of the things that I was not doing that we were having to keep track of is I would have to go through the schedule every day and say, okay, who's due to renew? Who's already used their plan? And then we'd have to make sure we wrote it down and we made sure to re-enroll them. Well, with Plan Forward, you don't have to do that. It's an automatic re-enroll and it automatically charges them yearly. So I don't have to think about it. The patient doesn't have to think about it. I do not have to have any administrative person looking after that, making sure that their plan needs to be renewed or doesn't need to be renewed. And that has saved us a ton of time.
That was a nightmare before. I remember going into practices and seeing the team struggling with all of the administrative work.
That's right. And so once you sign them up, the fee schedule is in place. You don't have to do any math. They handle all of that for you. They help you get it implemented. They get it integrated for you, whatever system you have. And really, all you have to do is get them signed up, which is super, super simple. And then you just enter treatment and it calculates it for you and you collect at the desk.
I have to ask you a question. So I know being a dentist, and I'm sure you belong to the local dental association and you go to these meetings. And so how do you ever talk about Plan Forward with the other dentists, and how is that received? I'm curious.
I do. So I'm a member of a bunch of different societies, but I have an all-female study group that we've been together for 10 years. And we tend to share all of our secrets with each other because we want to give our secrets away, right? If you find something good, you want to share it. And you also want to share when things don't work because you don't want to see your friend struggle with something if they don't have to. So we tend to share a lot of this together. And this, I have absolutely told them about Plan Forward because I had my own in-house savings. I knew other people that had their own. And I was like, if you want to save yourself a lot of hassle, just do it because it's a no-brainer.
And I have a client right now that is talking with them. Finally, it took about a year. And he's like, I think this is my only solution. I have to do this. So he's working with them about to get set up. But his question to me has been, and I've tried to answer, and I think I've done a good job with that, but I'm curious from you, from somebody using this, how do you think this has been a part of your return on investment? Is there a way to measure that? Or what do you think? New patient wise, maybe?
Yeah, I would say, we're like just shy of a year. I think that I'm going to see very soon, right? And that's when that re-enrollment happens. And I don't even have to think about it. There's an automatic amount of money that's going to come in.
Yes.
That I will not have to go and search for and bring them back. For example, let's say somebody, their year runs out, their premium is done. And let's say they didn't make another appointment for whatever reason. They're going to get re-enrolled. They're going to call me because they just paid their membership plan. And so they're going to get into my schedule. Right. Whereas before it stopped. So the return on investment, just that alone, of that re-enrollment that continuously happens is what is going to create that return on investment. And that's just a very small part of it. I mean, the administrative cost, and dentists know this, our overhead is so high right now with our staff cost. We have to minimize the amount of time that they spend doing certain things because we'll pay 3 times over for something very simple. But when the system like this is so streamlined, it's minimal amount of time. So again, return on investment, lowering your overhead, that's how you do it. And this is one of the systems that I use that helps to do that for me.
It's so good. And it's a no-brainer. I keep saying that.
A no-brainer.
Makes so much sense to me.
I wished I'd found them earlier. I really did. I wished I had. Again, intuitively, I knew this is what I needed to do. And I, searched a couple other different dentists, looked on their websites, I looked at all kinds of things, but this system fit me the best. I loved that they didn't tell me what I had to do. It was, no, you're going to create the system. This is yours. It's your practice. You're going to offer what you feel is part of this membership plan. We're just going to give you the design. And they do such a nice job. Like they create your branding for you. It's really nice. You don't have to do any of that. It's all part of it.
So do you get new patients that call the practice because you have this Plan Forward available, like a friend?
So they won't say specifically Plan Forward, but they will say, I know you have like an in-house, like a savings program or preventative care program.
Yeah.
And I know, because Michaela, my friend does, she's really great about, in the appointment note, she'll say, patient does not have insurance. We've talked about it on the first phone conversation. They walk in the door pretty much knowing that that's what they're going to do. She presents it from the very beginning. she's like, well, that's no insurance, no problem. We've got this great, and we can give them even our website. And sometimes they'll sign up before they've even seen me.
Yeah.
Because
that was was going to be my next question is the verbal skills. Like what, like a patient calls in, what are those verbal skills? Are your team members, are they saying things to existing patients throughout the office to promote it? How is that working?
There is not a single patient who does not have insurance that does not know about our plan. Usually I'm the one to close the deal if they've told everybody else no, because I say to them honestly, I am not trying to do anything but save you money. It makes no sense for you to pay this much. And I'm really flexible with it. I really am. I probably shouldn't be, but I love my patients. And even if they're a little bit on the fence, I'll retroactively do it. I'll make sure they still get the discount because I'm not trying to overcharge them. I want them to be within the system. I know it's going to benefit them ultimately by staying on a good preventative schedule. And then it's going to save them money. And then it's going to make my life easier because it's going to be a re-enrollment type of a situation.
Yeah, that retention is everything.
Totally.
So how many patients do you have on the membership plan?
So we have about 450 on a membership plan. Yeah.
And how many patients are in your practice?
We have about 2,500 active patients. Yeah.
Okay.
Yeah.
That is fabulous.
It's pretty good. Yeah. It's
really
pretty good.
Wow. So if you were like, there's people listening, okay, there's going to be hundreds of doctors listening to this. And we love Plan Forward and we talk about it, but from the perspective of a practice owner who's implemented this 450 times with your team, what is the secret to getting it to that level of success?
Good question. I think we like to say that we treat people really well. We treat them like family and we have their best interest at heart. Genuinely. We genuinely do. And so when I get someone who's retired and they come in and it's a couple, they go back to their 55 and older community and they tell them and they say, guess what? She does this plan. It's a preventative plan. It's great. And then guess what? I get another couple and they come in and they then also sign up. And the same thing happens. They go and they play bridge and then they come and then I get another one, and so I think it's word of mouth that one, we have this in place, and two, when they get here, we're going to treat them with compassion and we're going to do what's right by them.
Sounds like you have a very nice practice.
Thank you. We've worked very hard to get there. We've worked very hard. We love our patients. Where are you
located? What city?
I'm in Bucks County, just north of Philadelphia.
Okay. Yeah.
In Holland.
I'm sure the listeners are wondering.
Bucks County. Yep. Just north of Philadelphia.
Oh, that's exciting. Thank you so much, Abby, for letting us dive deeper into your practice in your life.
Yeah.
And if anyone wants to talk about this episode, come on the podcast or submit any questions, then you can do so by joining the Facebook group Dental Gumbo. And in there, you can talk to us, see more advice and suggestions that Sandy has for your front office, your team, and your practice. And go on the first link in the show notes below to check out Plan Forward. We have an exclusive deal for everyone. So thank you all so much for tuning in. And we'll talk to you in the next episode.
Bye, everyone.
Bye-bye. Thank you.